Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and a nurse educator. If you hear thunder in the background or lots of rain, I'm actually recording this while Hurricane Ian is going on, so I hope you don't hear too much ambient noise. Today I'll be going over 5 mental health NCLEX questions courtesy of nursing.com. Nursing.com is an excellent resource if you are in nursing school. They have courses, cheat sheets, practice questions, study plans, sim clocks, have videos, and their courses and videos can guide you through nursing school so that you can consolidate studying and focus on what you really need to know. If you want to learn more about nursing.com, check out my affiliate link below. A 48-year-old client is struggling with compulsive gambling. During the initial assessment, which question would the nurse most likely ask to assess whether a diagnosis of compulsive gambling may be appropriate? Are you feeling sad about losing money to gambling? Are you excited about the thought of winning? Have you ever tried to stop gambling but haven't been able to? Did you once enjoy gambling? An addiction or a compulsion is something that you can't stop even when you want to stop. Similar with alcohol. We ask the CAGE questionnaire. So compulsive gambling is a condition in which a client experiences addiction and dependence on the activity of gambling and winning money. A client states that she feels significant stress while caring for her young children. She has developed headaches, she's irritable, and she gets little sleep. Which of the following nursing interventions is most appropriate for this client? Reassure the client that the stress will be resolved with time. Have the client verbalize that she is feeling stress. Allow the client to punch a pillow to help with stress management. Explore feelings and survival tips that can help get through the situation. Even though survival tips make it seem like it's like naked and afraid, but I think they could have worded that a little bit differently. Some clients feel significant stress and do not have solutions for how to reduce the intensity levels of this stress. The nurse can help this client by exploring the client's feelings and discussing ways that the client can make small improvements. Rather than the nurse attempting to solve the client's problems or giving basic advice, the nurse should actively listen and work with the client and family members as they problem solve. So reassure, usually in mental health, if you provide reassurance, it's a non-therapeutic technique of false reassurance. We don't reassure because we don't know if things will pass or get better. A nurse who works in a healthcare clinic is utilizing primary crisis prevention with her clients. Which actions demonstrate this level of crisis intervention? Select all that apply. Primary prevention aims to prevent disease or injury before it ever occurs. So examples of this are legislation and enforcement to ban or control the use of hazardous products, education about healthy and safe habits, eating well, exercising regularly and not smoking, and immunizations against infectious diseases. So primary crisis prevention, teaching a community group about HIV, offering a parenting class to new mothers, and I think that's it. Because finding a shelter, this person is already experiencing abuse, so this is tertiary prevention. This is before it happens, right? So, which are primary, secondary, tertiary prevention. Primary describes preventive care and education with any group before a crisis occurs. Secondary describes preventative care and teaching to at-risk groups. And the reason why this one was correct is because the teaching is directed towards a community group, not a high-risk group of contracting HIV. So if this was specifically targeted to a high-risk group, then it would have been secondary prevention. A nurse is caring for a client who has been diagnosed with bipolar disorder type 1, which best describes the difference between bipolar 1 and type 2. Bipolar 1 is associated with alternating mania and depression, while bipolar 2 is a continuous state of hypomania. No. Bipolar 1 describes mania or the high feeling of the disease, while bipolar 2 describes a depressed state. No. Bipolar 1 leads to extreme depression, while bipolar 2 causes more subdued depression. Bipolar 1 is associated with alternating mania and depression, while bipolar 2 is associated with hypomania and depression. That is the best answer. People with bipolar 2 can also be very depressed. It's not a more subdued depression, and they are just as much at risk of completing SI than the bipolar 1. Bipolar disorder is classified according to a spectrum of the condition, as some clients may experience varied symptoms of the illness. Bipolar 1 is associated with periods of manic behavior alternating with periods of severe depression. Alternatively, bipolar 2 causes periods of depression and hypomania, which is a period of emotional high that is less drastic than mania but is still noticeably atypical behavior. The depressive episodes and the two types of bipolar disorder can look the same. The nice thing about nursing.com is that there are rationale videos if you miss a question, and you can be educated on that topic more. A 35-year-old pregnant client tells the nurse that she has been feeling significant stress in her life since she became pregnant. Select all of the appropriate measures the nurse can suggest as part of stress reduction in a pregnant client. Ask for help, definitely meditation or yoga, address the things. All of these sound correct. Eat regular nutritious meals, address the things you can control that are stressful, schedule time for yourself. You can pause to read the rationales. Thank you so much for watching. Make sure that you hit that like button and you smash that subscribe button. I currently have a goal of hitting 30,000 subscribers. I've been at this for 3 years and still haven't reached it. So it would mean a lot if you subscribed, and keep in mind that it doesn't cost you anything to subscribe and you can always unsubscribe later. Until next time.